With growing concern over the spread of infectious diseases in the detention facilities, stakeholders under justice, law and order sector intensified efforts to integrate health services into the criminal justice system. In 2022, health screening services were introduced in 12 police stations to support early detection and prevention of HIV, tuberculosis and malaria. Today they have launched the Criminal Justice Health Rights Committee, aimed at strengthening, coordinating and expanding these services across the sector, including prisons.
The implementation of the Global Fund program within our criminal justice system is a landmark step. This initiative, backed by a commitment of billions of shillings, is not just about funding. It's about human dignity. We must therefore intentionally target the triple threat of HIV, tuberculosis, and malaria disease. We are mindful that the courts are the ultimate guarantors of rights to health. We shall sensitize and empower all our officers to be proactive and mindful about the physical well-being of their chosen persons appearing before them.
While launching the committee, Chief Justice Dr. Flavian Zeija emphasized the link between health and the effective administration of justice.
To the Ugandan police force, let us also be mindful that justice begins at the intake. Congested police cells may turn into breeding grounds for infection. Please ensure that the suspect's health does not deteriorate before he or she even sees a magistrate. If a suspect has a chronic condition like HIV or TB, consider how this affects the speed of the trial.
The Office of the Director of Public Prosecutions has pledged its support towards implementing the strategy.
To ensure that things are done properly in accordance with the guidance provided and the regulations. It also includes the coordinator of Criminal Justice Programs Management Unit. The committee will promote achievement of equity. Dr. Shaban was talking about equity, very important.
Commissioner from the Ministry of Health and Head Non-Communicable Prevention, Disease and Control, Dr. Stavia Tuliahebwa, welcomed the initiative, expressing optimism about its impact in controlling disease spread within justice and prison.
We continue with that kind of approach, looking at people as people, despite of their criminal background. Let's have time to check ourselves, to know how we stand, as far as pressure, as far as diabetes, as far as cancers.
The initiative will be funded by the Global Fund and is expected to improve health outcome among the inmates and staff across the justice system. Stakeholders present included representatives from the judiciary, Uganda Police Force, Uganda Prison Service, the Inspector of Government, the Office of the Director of Public Prosecutions, and civil society organizations. The establishment of this committee marks a crucial step to ensure that access for health services becomes an integral part of Uganda's criminal justice system. Deborah Namamonde, Viola Nansubuga, UBC News.